medication that is not good for pregnant women. First trimester of generally pregnant women that are pregnant. These medications I'm going to mention now are not good for women that are pregnant. Number one, if you are pregnant, please don't take ibuprofen for me. Don't take ibuprofen. Ibuprofen is really not good for people who are in their first to third trimester. It can cause oligohydramnios. Oligohydramnios simply means that the amniotic fluid that is holding that child will start drying up, which can increase the risk of what? Bleeding during labor. So if you are pregnant, please stop taking ibuprofen. Number two, aspirin. If you are pregnant, if a woman in her third trimester, you have no business with taking aspirin. Yes, if a woman and you are in your third trimester, you have no business with what? Taking aspirin. Aspirin can increase the risk of bleeding during what? Labor, and it lowers birth weight. Aspirin can increase the risk of what? Bleeding during labor, and it also lowers the child's what? Birth weight. Number three, codeine. Those of you that are pregnant, or you are in your third trimester, or you are even breastfeeding, and you are taking the likes of tramadol, you are taking the likes of opioid, all these opioid analgesics, you are taking codeine. These things are generally not good for you as a breastfeeding mother or as a pregnant woman. Do you know why? It can cause impairment in cognitive function of that child, impairment in the brain development of that child. If you know you are taking codeine or any opioid analgesic, just know that the cognitive function of that child will be affected. Chlorphenicol is an antibiotic, and it is not good for a pregnant woman or a lactating mother. Do you know why? It can cause a gray baby syndrome. It can cause bone marrow problem as well, and in fact, it can also cause cognitive impairment in that child. Taking chlorphenicol while you are pregnant or while you are breastfeeding can cause cognitive impairment in that child you are nursing. So it's not good. Number five, tetracycline. Tetracycline is an antibiotic. It is not good for you if you are pregnant. It normally stains the teeth of a baby while the baby is growing, because tetracycline is passed through breast milk, and once the baby starts drinking breast milk and the baby takes it in, the baby will excrete it out as well. So it is not good for that child. It can cause stained teeth in children. Number six. The sixth drugs you shouldn't take if you are pregnant is diazepam. Diazepam or any of the benzodiazepines is not good for you as a pregnant woman. Do you know why? It can cause facial malformation for that baby, to make the face of that baby not to form well. So if you are pregnant, please do not take diazepam or any of the benzodiazepines. An immunosuppressant patient or a chemotherapy patient, please do not take methotrexate, especially when the person is in her third trimester, because it can cause severe birth defects. It can cause miscarriages as well. It can cause malformation of the infant and growth retardation in that child, and it can also cause cognitive impairment in that child.